Hi, Miss Barron.
Yes.
Hi, I'm Dr. Sarkar. Nice to see you again. How are you doing? So. I wanted to go over the your most latest imaging and labs and things, but I wanted to get your sense of what how things are going and what your understanding of how everything is right now. So, what are your thoughts?
Well, I'm eager to hear the test results.
Okay. Okay.
Mm.
You had the radioembolization several months ago, and we've been following you since then. And so your latest results are showing. I can go into the specifics. And how much information do you want me? Do you want me to go through all the specifics, or sort of the highlights,
I
or?
want as much information
Okay.
as possible.
All right. So the short answer, and then we'll go into the details about each thing, are that the tumors in the liver are continuing to grow, and they have not responded that well to the radioembolization. So the disease is progressing, and we can see that in the imaging, and the labs are also showing that. And along with that, also your liver function is deteriorating. You're probably feeling abdominal distension. You have some fluid in your abdomen now, and these are all signs that you're not responding to the treatment, and the disease is progressing.
It's not good news, is it?
No, it's not. I understand that this is upsetting and a lot to take in, and that is very normal reaction, and this is a very difficult discussion to have. But the truth is the tumors responded a little bit initially, but now they are growing, and the disease is progressing. So basically, as far as prognosis and what this means, it's hard to say, but this is not. It's very difficult to say, but this is not a good sign, and this means that further treatment with this is really not going to do us any benefit. And at this point, our treatment or our efforts are going to have to sort of center around things that we can do to make you comfortable, and really make you feel as good as we can. But as far as the disease and the prognosis, we can't really do much in terms of trying to treat the disease. Does that make sense? Mm-hmm. No, I understand this is very upsetting to you. What are your thoughts, and what are your...
I don't know what my thoughts are right now. It's just very overwhelming.
Uh-huh.
It's distressing.
Mm-hmm. I understand. I can imagine this is extremely difficult. Do you have any family or anyone you can talk to about this, and do you feel comfortable talking to? I'm happy to sit down with family members, or make a family meeting if that's easier. I want you to know that been talking to your other doctors, and that we're all on the same page, and that we can continue to do things to help improve your quality of life and make you feel better, and that we can all work together towards that, and but I can understand this is very, very difficult. Do you have any other questions about the everything that's going on?
Well, I mean, how long do you think I have left?
It's difficult to say, but with the rate that it's progressing, I would say the median survival would probably be 6 months to a year, but it's very hard to predict that for sure. And everyone is sort of different, but but like I said, what we can focus on is doing things to try to improve your quality of life for the remainder of your lifespan, and things like the abdominal distension and the fluid that you have building up, or the lower extremity edema and those things. We can do things to try to help alleviate those, so then you can have as close to a normal quality of life as you can. Okay. Again, I know you're probably going to have a lot of questions and a lot of concerns, and if anything comes up, feel free to give me a call. I'd be happy to go over anything with you again, and again, I'm happy to discuss things with your family or your other doctors as well.
Yeah.
Okay. Any other thoughts or concerns, and anything I can help with?
Well, I mean, yes. You said you'd make me feel as comfortable as possible, but what am I to expect with how will my body deteriorate, or will I suffer?
Well, I think some of those things, I'm not the expert that can give you all of those answers, and I think the oncologist will be able to answer some of those things a little bit better than me. But because the tumors are not responding to now the chemotherapy and the radioembolization, they are going to continue to grow, and your liver function is declining, and that's why you are having fluid build up, and your labs are declining. So that will continue to progress, and ultimately you will die from this, from the liver disease. Now, our goal is to keep you as healthy and as feeling as good as we can for as long as we can. Okay? Again, I know that this is a tremendous amount of information, and this is a lot to take in, and I can see that you're clearly upset, and that's very normal reaction, and you're asking all the right questions. I commend you on your composure on this, and again, anything I can do to help with this, and I'm glad to answer any questions. Okay. Anything else I can answer or clarify for you?
What do you think should I tell my family or my children especially?
Well, that is a very personal question, I think that's gonna be up to you as far as how much you want them to know and what exactly you want them to know. I think I think it would be a good idea for you to tell your immediate family, and to help them, help you cope with this and also help them prepare. And again, I can help facilitate a family meeting if that makes it easier to break this kind of news, because I understand that this is a lot of information, this is very difficult, but that may be,
When I think about it, but thank you for offering.
okay. And yeah, anything else?
Well, I can't think of anything right now.
Okay, all right. Like I said, if anything else comes up or you think of anything, don't hesitate to call, and I'm happy to go over anything or help in any way.
Thank you.
Okay. All right, Ms. Marin. Thank you.
Yes, he did. And she understood it. Yes, he did that too. He did that too. And she understood what I had said. Asking me questions. He really did all that.